Okay, so hello everyone. Today I'm gonna be presenting resting measurements and the cardiorespiratory fitness. So basically what we have in here is on how to assist blood pressure on a client. So for step one, how to assist a client with blood pressure. It is important that when assisting blood pressure on the client, she will avoid drinking coffee or foods prior examination to be accurate when analyzing systolic and diastolic blood pressure. Um, this is because when the individual consumes food or energy drinks, blood glucose will rise heart rate and interrupt such results during the analysis. In addition, it is also being recommended to avoid any possible exercise on the client prior examination. Step two, we have the client relax and sitting down at a chair with both feet flat on the ground, making a 90-degree angle between the femur bone and the tibia bone. The client shouldn't be talking or doing something else. The client should have his or her back straight during this process of examination. In step three, we have the client remove watches or bracelets from their wrist and remove any clothing from their left forearm. In step four, once the forearm is being clear and no other clothing is obstructing, please provide the client to extend his forearm over the table and position his or her forearm at a supine position. Then you can go ahead and we have then blood pressure, the sphygmomanometer. So normal range of blood pressure is between 120 over 80 in men and 110 over 70 millimeters of mercury in women. According to the ACSM, possible mistakes on how to assist the client with blood pressure are the following: inaccurate sphygmomanometer, improper cuff size, auditory acuity technician, rate of inflation or deflation of cuff pressure, experienced technician, faulty equipment, improper stethoscope placement or pressure, not having the cuff at heart level, certain physiological abnormalities, reaction time of technician, background noise, allowing patient to hold treadmill, hand drills, or flex elbow. So we have how to assist. These are the equipment needed. Next, we have the BMI. This is the type of equipment needed to check for BMI, which is the scale and the freestanding height measure. So how to assist BMI measures weight and height. Weight has to be in kilograms, kg. Step one, we have the subject step on the scale. However, prior stepping on the scale, the subject will remove any items from their bags and remove tennis shoes to begin weight measures. Record weight in kg. Then we have the height. The height is measured in meters. Step two, have the subject remove tennis shoes so he can be able to step on the freestanding height measurement machine. Position the subject with both feet together, back straight, both arms and hands straight, erect from each side. Record height in meters squared. So body mass index classification. There are several categories and classifications for body mass index. According to table 4.1 from the book Guidelines of Exercise Testing and Prescription, there's a BMI less than 18.5 kg/m square is classified as underweight. BMI ranging between 18.5 to 24.9 is classified to be in the normal range. A BMI between 25 and 29.9 is classified as being overweight. Anything higher than 30 kg/m square is at risk of cardiovascular disease such as possible heart attacks and metabolic diseases. We have table 4.1, below 18.5 is underweight. 18.5, 24.9 normal weight, and 25.9 and 29.9 it's overweight. So it is considered that between 30, a BMI 30 and above, it already starts between obesity class 1, obesity class 2, and obesity class 3 as it goes respectively. Then we can follow up with the step test. The Queen's College step test for the prediction of CRF relies on having the subject up and down on a standardized step or bench for a set period of time of 3 minutes at a stepping cadence. Once the set is being complete, we should identify the heart rate to predict the CRF level of the subject. According to the CSM, resources for the personal trainer, the lower recovery of heart rate, the more fit the subject. Equipment for the step test. So we have the metronome, which is set up at 96 beats per minute. We have the watch to record a 3-minute mark, and the heart rate monitor. The standardized bench step height of 16.25 inches. Most step bench height average between 18 and 20 inches. So that's fine. Then we have the 12-inch box bench or step. The purpose of the step test is a 3-minute test, measures cardiovascular fitness recovery, which is the heart rate. And these are the ratings for men based on age. We have excellent, good, above average, average, below average, poor, and very poor.